I am Rashawn Ali, and thank you so much for joining the American Red Cross and BlackDoctor.org for an evening of coffee and conversation. Tonight, we are discussing sickle cell disease, blood donation, how it impacts the Black community. We have 4 dynamic panelists who come with a wealth of knowledge and experience. And before I introduce them, I want to remind you to please drop your questions in the comment section for our Q&A. We do have an allotted time for you to ask questions a little bit later on in the program, so please make sure you utilize that feature. In addition, please visit www.redcrossblood.org/ourblood for more in-depth information. All right, we are ready to get going because we have a lot to do in a short amount of time. So let's get right into it. Please welcome Dr. Yvette Miller, Miss Lydia Langford, Mrs. Christy Ross, and Mr. Adrian Williams. How is everyone doing tonight?
Doing well. How are you doing?
I am doing well. Yes, everybody looks great. Everybody looks great. We're ready to get into this very in-depth conversation and so much information to share with our audience here tonight. Yvette, we're going to start with you. You know, most people, of course, have heard of sickle cell, but I don't really think people know the severity of it and actually what happens in a crisis. Can you explain what sickle cell is and how it comes to be?
Yes, thank you, Rashawn. Sickle cell disease is a genetic disease that is inherited from our parents. In the United States, it is the most common inherited blood disease that affects about 100,000 individuals, the great majority of whom are African American of African descent. So this conversation starts with parents that both have sickle cell trait. And so each parent can give one of those sickle cell genes to their child. And when a child gets 2 sickle cell genes from their parents, then that child has sickle cell disease. And so that's how sickle cell disease is inherited. One of the most common manifestations of sickle cell disease is the pain crisis. And that's probably what most people are familiar with. The abnormal sickle cells do not carry oxygen to the tissues like normal red blood cells. And so that's what leads to the pain crisis, is when the tissues of the body are starved for oxygen. And anytime the body is starved for oxygen, the first symptom that occurs is pain.
Thank you so much for that information, because I think people don't really know like what actually causes the pain. We just know that our sickle cell warriors are in a lot of it. So thank you so much for breaking that down. And Lydia, you are just an amazing woman. I'm so glad to know you now, having met you virtually yesterday. You are absolutely a light, and you are living with sickle cell. Can you tell us when you were diagnosed with sickle cell and how it has tremendously impacted your life?
Well, thank you so much for having me here, Rashawn, and thank you to Dr. Miller. I was diagnosed with sickle cell when I was 2 months old. So my mother said to me that I had this scream that was completely unnatural, and I just would not stop crying. And so they took me to the doctor's office, to the different hospitals. I got so many genetic tests run on me, and it came back that I was positive for sickle cell. And the way that I have it is just as Dr. Miller explained. My mother has the trait for sickle cell. Unfortunately, she wasn't screened. They didn't have screening at that time, and so she didn't know that she had sickle cell trait. Same goes with my father. He had sickle cell trait as well, and me, myself, I am the only child, and I have full-blown sickle cell type SS. So the very full-blown disease is what I was diagnosed with and what I've been struggling and dealing with.
Right. Absolutely. Um, so you were a baby and your parents are trying to console you. What was that like for them? I know that you can talk to them in retrospect. What was that like for them?
Oh, goodness. My mom said that the day I was diagnosed with, sickle cell, she walked outside of the hospital. She just needed a breath of fresh air and she just got just bombarded. She had no idea. She knew somebody that had sickle cell, but she herself had never dealt firsthand with it. So all that she knew was that she had a neighbor with it, and that neighbor passed away at a very young age, and she didn't want the same for her child. So um, she told me that she was absolutely terrified and just fear, depression, um, defeated. She just felt all of those things all at one time, not being educated and not having any of the resources available. All she knew is that sickle cell was painful. And I have a friend that passed away at a very young age with sickle cell, and I don't want my daughter to have to go through those things and struggle with the pain and end up passing at a young age as my friend did.
Right, right, absolutely. I'm sure it had to be very, very tough, and but we're so glad that you're thriving and
Yes.
doing well. Yeah,
Yeah.
and I know we'll hear a lot more of your story as the night progresses. Progresses. Yvette, you work directly with the American Red Cross, who has launched this initiative to increase blood donations in the Black community. What makes Black blood so diverse, and why is it so important that we encourage our community to give blood?
So, as African Americans, we have some structures on our red blood cells that are more common in people that are African American of African descent. And they're called antigens. And when these antigens have to be closely matched between the donor and the recipient, and because most of the people in this country who have sickle cell disease are African American of African descent, it makes it critically important that those donors match the recipients. And as African Americans, we have a fairly low percentage of individuals who are donors in the African American population, probably about 2 to 3%. And we need tremendous numbers of African Americans to donate blood because some sickle cell patients, and Lydia will tell us her story, some sickle cell patients can need over 100 units of blood in a single year to treat the complications of their disease. And so there again are thousands of people that require these transfusions all year long. So you can see how many thousands of units of blood that we need annually to treat these patients with sickle cell disease. And most of those donors need to be African American of African descent.
So that people get a better understanding of what the blood actually does and how it helps sickle cell patients. Can you break that down? Because I think if people understand the why and
Mhm.
how it can help, maybe they'll be more willing to do it, because we have to overly convince our community when it comes to donating, taking vaccinations, and so much more. So, can you explain what the blood actually does and how it helps sickle cell patients?
So, sickle cell patients, the cells that they have in their body are those odd shaped, C shaped cells that do not carry oxygen appropriately. So they need a transfusion of normal red blood cells from a donor. And so whenever those patients have a pain crisis or they get an infection and then their body starts to respond to that infection by having pain, then the only first they need pain medication. That's the first thing. Then the second thing that they need to alleviate those complications and get oxygen to their body is to have a blood transfusion. So the normal red blood cells in that unit of blood are transfused to the patient, and those normal red blood cells carry oxygen to the tissues, which then stops that pain crisis.
Gotcha.
That's it. That's simple.
Right. Okay. So that gives us a better understanding as to what the blood actually does and how it can help sickle cell patients. So that
Mhm.
makes so much more sense. And so that people can just become a little bit more educated and aware as to why this is such a need, especially in our community. Christy, let's bring you in. You've been waiting patiently and You have, had extensive experience in public health, because this isn't an isolated disease. We need the community to understand the urgency around this. But we know why now, but how do we really get people to actually take action?
Well, thank you so much, Rashawn. And I've enjoyed, the conversation, because this is such an important issue, an important topic. And, being with the National Association for the Advancement of Colored People, we are really thrilled to be in partnership with the American Red Cross on this issue, because we know our blood does save lives. And so we need to really think intentionally about how do we get more individuals to give blood, for all the reasons that Dr. Miller shared, and also for Lydia's story and all of those who really are warriors suffering through this throughout their entire lives. And so, to your point, I think it's really important to do things like this: get educated, get the facts, make sure you have all the information, and then, of course, most importantly, to give blood. To give blood and to encourage others to give blood as well. And so it's a delight to be a part of, panel discussions like this, to bring information, to bring facts, and to bring those stories to light, so that we can educate the community, but we can also encourage folks to give blood. So really to take action and do something about it, and encourage everyone in your networks to do the same.
Absolutely. And Lydia, you are the person who represents so many warriors who are dealing with and living with sickle cell. You understand the pain from the many crises that you have endured, the blood transfusions. Speak to us about what a day in the life is like for you, because I think if we get a better picture as to how the Lydias of the world are actually trying to navigate life with this disease,
Absolutely.
we'll be able to better grasp why this is such a huge thing that we need to take on.
Absolutely. And thank you for asking about that. That is so important, a warrior's life, and how we deal and get along with things from our day to days. I know that a typical day for me, on Mondays, I have my home health nurse come, and she comes to my home. I have this port that you can see visibly right here. And I have to get this maintained every 7 days. So the needle needs to come out, it needs to be changed, it needs to be disinfected. So we have to go through all of that with that ritual. I've got to get blood collected for the week, and know how my blood counts are doing. The hemoglobin and hematocrits specifically are what I look for with my sickle cell, and those numbers need to be up and at a good level, so that keeps me out of the hospital and keeps me not needing so many blood transfusions. Right now, though, unfortunately, every month my blood counts are in the critical levels, so I end up having to receive blood transfusion once a month. I end up going to my hematologist office, and she'll check my blood counts with my port, and she'll say, Lydia, I'm sorry that you're going to have to get some blood. And that means I go over to the emergency room, where I spend about 5 or 6 hours of the day getting typed and crossed, making sure that that blood is not going to have a reaction with my blood. And that's why specifically African American blood is so important and so needed, because we don't want to have a reaction. We don't want to get a rejection, any of those things like that. And so once all of that's due and done, then I'm ready. I go ahead and I get myself my blood transfusions, and then I go about my month, and I'm able to live life somewhat normally, and go see my friends. I am able to work and speak at events and meet wonderful people like you lovely ladies. And I get to talk about sickle cell and the struggles, and also the blessings, the blessings like blood donation, because without that, I would not be alive. I stopped counting exactly the number I had when I reached 600. And at that time, it was like, well, yeah, I think that's that's enough. I can stop counting and saying, well, it's 610 transfusions or it's 620. It's like, yeah, 600 is a lot. So I think people can understand that the need is very, very severe. And I'm just one person, one warrior. We've got 100,000 out there, like Dr. Miller said, that need our services and resources as well.
Absolutely. Absolutely. Thank you so much for sharing that, because
Sure.
you have to really, I think, everyday people need a snapshot of what it's like to be Lydia. And we're just so grateful that you're here, and so grateful that you are continuing the fight, because you could do this alone and you could sit and not even speak about it. But we're so grateful that you are speaking about it and are here with us tonight. We also want to remind you to drop your
Thank
questions
you.
in the comments for our Q&A. And again, our website is www.redcrossblood.org/our blood. Yvette, are there any misconceptions around blood donations, and why? Why is it just 2 to 3% of our people that donate, or who donate?
Well, what I commonly hear is that a person will say that they're afraid of needles. And again, Lydia will tell you her story, but the way that I explain it to them is, people who have sickle cell disease, they spend so much of their lives in pain. It really just takes a moment of discomfort for you to experience the opportunity to donate blood to support the transfusion needs of a patient with sickle cell disease. When blood is needed, only blood will do, and only human beings can donate blood. And so when you share the information like that, or you have a conversation with someone about that, they usually get it. So another misconception about patients with sickle cell disease, and I already mentioned it, is that, again, I think most people are familiar with the pain crisis. And so most people think, well, if you're in pain, the only thing that you need is pain medicine.
Mm-hmm.
And they don't really connect, what else would a patient need, and the whole blood cell issue. So it's
Yeah.
important, just like Chrissy and Lydia have said, education is really the major part of what we're doing here. Once we explain to people that it's the lack of oxygen that is causing the pain that patients feel, because their abnormal red blood cells do not carry oxygen. So the red blood cells that they get from the transfusion helps decrease that pain and helps them live their best and healthiest lives.
Awesome. That is so fantastic. Christy, what kind of impact does an organization like the NAACP have on efforts such as this one?
Well, the NAACP, I think we have enjoyed a very long and storied history, but really that's been built on a tremendous community reach. We have over 2,200 affiliates, and so we have people doing some really amazing things in the community throughout, all of the United States. And so that has been, I think, one of the benefits and what we bring to the table, and we're really happy to bring, is that community reach. And so I think just what our affiliates do, what our community members do in terms of education around this issue, making sure that it really becomes front and center for their field work and their community-based work, can have a tremendous impact. I think the NAACP brings a lot of relationships and trusted relationships, but having a partner like the American Red Cross and having warriors like Lydia really join, and all of us be in lockstep together to say, get educated, get the facts, but most importantly, give blood and encourage others to do the same. This is a way to really help our community, and we're uniquely positioned to do that. Our blood is very unique in this way. And so we are delighted. And I think to bring 2,200 affiliates to the table in service and to help warriors like Lydia, we are extremely delighted to be in partnership with the Red Cross.
Absolutely. Dr. Yvette, Dr. Miller, can you tell us how people can directly donate to this?
How people can directly donate, is to go to redcrossblood.org, again, /our blood, and enter your zip code, and sites will come up where you can make your appointment to donate. You can also call 1-800-RED-CROSS, and Red Cross has an award-winning blood donor app that you can download, and you can make all of your appointments through the app, and then all of your health information that you learn, as well as if you're African American we have a program where anyone who self-identifies as African American, we're performing sickle cell trait testing. And you heard the important information that Lydia communicated to us, is that many people do not know their sickle cell trait status, and that can have an impact on their lives and on the lives of their children. So it's incredibly important to know your sickle cell trait status, and we are performing sickle cell trait testing. So all that information can be available in this the American Red Cross blood donor app. So please download that app. But either way, please call and make an appointment and to donate blood and show up. It's one thing to make the appointment and not show up.
Right.
So we make that appointment, make that commitment and show up.
Absolutely.
Yes.
Absolutely. Speaking of showing up, Lydia, you show up not only for yourself every day and for your family, but you are making waves in the government too, and in Congress. Tell us about what you're doing and the fight for sickle cell.
Oh, thank you. Yes, I love taking sickle cell, and I want everybody to know, and just creating awareness about the situation, about what we warriors go through really is just, I feel it's the most important thing. And so, Rare Disease Legislative Associates is what I work for and with in Congress, and I am very blessed to get the ability to speak to Congress 4 times a year. And so each quarter we go and we discuss sickle cell, some of the problems that I face in the hospital, and not just myself, but other sickle cell warriors as well. We want everyone to get the best care. And that all again starts with awareness and resources. And so we're so blessed as warriors to have people that care about us at the Red Cross. There are people that care about us in the NAACP, and they are, they're working every day of their lives to ensure that we have a life and that we not only survive, but we thrive as warriors. And that's, I'm sorry, I'm not going to cry.
No, it's fine.
It's just so important because it gives you that sense of community. It gives you that sense of support. And it gives you that feeling that, other people care about your life. They see the value of your life, and they are going to work to get you as pain-free as possible and living your best life. And one really cannot ask for more. And I know I've been in this situation where I've had over 600 blood transfusions. That is so much. And with each one, I still do it to this day. I get the blood and I hold it and I thank the individual. I'm never ever going to meet them. And I know that individual that has donated this blood for me, but I just like to tell them thank you. And although you don't know me and I don't know you, our lives will never pass. Just know that what you do is life-saving, and you're giving someone the best gift in the entire world, which is more time in this world. So.
Absolutely. Dr. Miller, what progress has been made in research for sickle cell? Where are we? And we know that there is a huge disparity because this is a primarily Black disease. And it's so glaringly obvious, and we're not here to really talk about that, but it needs to be stated. But how much progress have we made so that Lydia can continue to live her best life? We know that we need these blood donations, but how much progress have we made?
Mm-hmm. So in terms of medications, in 1998, there was a single drug approved by the FDA to treat patients with sickle cell disease. And from 1998 or 97 to 2017, it was that single drug. It's called hydroxyurea. But in 2019, since 2019, 3 drugs have been approved by the FDA to treat patients with sickle cell disease. So that is progress. The only cure for sickle cell disease is a bone marrow or stem cell transplant. And probably only about 25% of people have a matched sibling, brother or sister, that can be the donor of that bone marrow or stem cells. Because in this country, the majority of those transplants are done with a matched sibling donor. But what happened in 2019, which was related to research, the gene editing tool, most people are probably familiar with it, is called CRISPR, where you can take out an abnormal, since sickle cell disease is a genetic disease, this gene editing process, you basically take some of the stem cells from the patient and you take them to a lab, and you actually clip. I'm back.
Oh, there we are. Okay, we are back. Hey,
Sorry, not sure what happened.
Listen, I'm so glad. Thank you, God, for allowing us to come back. You know, we are still in a virtual world right now. So thank you all to all of our guests. We appreciate you for hanging in there. Dr. Miller, you can proceed seemingly where you left off. We only lost maybe about 30 seconds.
All right. So this new research where you can actually clip out the abnormal gene and then insert the normal gene. And then the sickle cell patients can start making normal red blood cells. And this patient was first transplanted in 2019, and she is doing well today, not needing any transfusions.
Wow.
So it's not approved yet, but it's research that has proved to be really durable and lasting. And it's going to be a blessing when it is approved by the FDA.
That's great. Look, Lydia's smiling on that. Like,
Yes.
how does that make you feel when you know
Oh my
that there's
goodness.
progress being made?
Just to know that, just because, sickle cell is a genetic disease, it's not something that I caught when I was 10 years old or 15 years old. I've been struggling with sickle cell since the very day that I was born. And, like Dr. Miller said, there is currently no universal cure, but to know that research is happening, to know that people are out there every day trying to find that cure, every day they are working day in and day out so that you can take your degrees that you worked so hard for in college, and they're not going to be a waste. You're going to get to go back to work, and you're going to get to go and shine and thrive and live that life that you've been wanting your whole life to have, and to go out there and shine and live your best life and do all of that. You've been waiting and waiting and waiting and waiting, and somehow your struggles with sickle cell, they keep coming for whatever reason, but that you can just keep looking to the hills because there is help that's coming, and that is so, so promising, and it just makes me do my happy dance all the time. So.
I love it. Christy, we want to make sure we bring you back in. As a public health professional, what more can be done?
I think, I'm listening to Lydia, and I think remembering Lydia's story and remembering that there are many more Lydias out in the community. And so, once this wraps up and, once, we will have concluded for the night, to remember that we're talking about real people. We're talking about human lives. We're talking about quality of life. And so I just want people to remember front of mind, whether it has impacted your family or you personally or someone in the community. Remember Lydia's story and what she's saying, and the fact that there is something you can do. So not only, beyond education and getting all the facts and learning as much as you can, but rolling up your sleeve and going to the website, as Dr. Miller outlined, and, punching in your zip code. Take action. I think that Lydia is worth it. And all of the Lydias are worth it, and they deserve a quality of life. And there's something that we all can do for the Lydias of the world. And so I want people to remember that well beyond this discussion we're having.
Absolutely.
Yes.
Dr. Miller, there's obviously concern about COVID. We're in this pandemic still. and donating. Can you speak to that as far as donating during a pandemic, donating blood during a pandemic?
Yes, thank you for that question. Well, again, at the Red Cross, we definitely use all of the CDC recommended recommendations with, enhanced cleaning, social distancing. Everybody who enters the donation site must wear a mask. So we're still, abiding by those recommendations. We have to be feeling healthy and well. So again, those are the most important things. We absolutely are concerned and aware of the sort of hesitancy for people to come out and donate. But again, wearing the mask, frequent hand washing, social distancing, those things are all in place. I was at a blood drive today
Yes.
when all of those things in place, people were moving smoothly through the donation site. Every donor has an appointment, so every donor has to have an appointment, so we control the flow of people through the collection site. So we have everything in order. All you need to do is make that appointment, show up for that appointment, and donate that unit of blood to help save someone's life.
Yes. Are there any restrictions when donating blood?
Well, again, you have to feel healthy and well. You have to weigh at least 110 pounds. And in general, there are very few things that limit a person's ability to donate. We do ask a series of questions and you can fill those. We have another, it's called Rapid Pass, another way of answering those questions before you even get to collection site. Go on your day of donation, you just go to the Red Cross website, put in Rapid Pass, and all the questions and all the information that you need to get to the collection site will pop up. And so if there's any questions in relationship to whether you're eligible or not, they can be asked and answered at that time.
And how often can you donate blood?
You can donate blood every 2 months or every 56 days.
Wow. Okay, that's good. So we should have people signing up right now. Please make sure you do it on the website. It's right there, redcrossblood.org /our blood. In our prep conversation, we talked a little bit about the screening. Now when children are born, the screening for sickle cell trait and sickle cell. And that was not even mandated until 2006. Dr. Miller, can you talk a little bit more about how that has advanced in the medical world? And then we'll talk to Lydia a little bit more about, her experience with that and knowing that is taking place now. Go ahead, Dr. Miller.
So in some states, it was a public health mandate for newborns to be screened for sickle cell trait, all newborns, regardless of race. There was some mandate in some states to screen newborns, but only since 2006 has it been mandatory in every single state of the 50 states that every newborn be screened for sickle cell trait. And that's important because that's health information that you learn and that's available to your parents. In many cases, that information, however, does not get to that person when they get older. So what we're working on now through a task force called the Sickle Cell Task Force that's part of the American Society of Hematology is that we're trying to get a national standardized way to capture that sickle cell trait testing information and make it part of a person's permanent immunization records, because immunization records follow you everywhere.
Right.
So that's what we're working on right now because that information is critical.
Yes. Lydia, I want you to speak to what Dr. Miller just spoke about, and then just, encourage people to understand the enormity of why we are here tonight to continue to donate blood and why it's so important for you.
Absolutely. Knowing that it wasn't until 2006 where all of us in the United States, this is possible to have this free screening. It just, that's just not so long ago. And it speaks a lot to me because I was diagnosed when I was 2 months old. So for a while, my parents had the education. They were set up with a child hematologist. They were given pamphlets from the Red Cross, from sickle cell organizations and foundations. They were connected with resources. Those resources, I feel, helped me grow up and learn the best and the most that I can about sickle cell so that I can be proactive rather than reactive with my care. I would love to know about things that happen with sickle cell before someone comes in and tells me, hey, Lydia, so this is going to be happening to you. You know, in November, you're going to be having a you're going to have your hip replaced, total hip replacement surgery. And the reason you're going to have this happen is because when you have sickle cell, your blood also destroys your bones and other organs. And unfortunately, replacement surgeries are very standard and number one. Okay, if I could have known that a long, long time ago, I'd have time to prepare. I'd have time to set up and find myself a good orthopedic surgeon. I'd have time to find myself a proper sickle cell specialist and get on a proper diet, a proper regimen, proper home health care, nurses and things that are going to help us survive and thrive as warriors and still graduate from college and still graduate summa cum laude with the 2 degrees that you wanted to have. And
Yes.
people be baffled and say, you did that with sickle cell? And you can be like, mic drop. Like, yes, that was done.
Yes. The
I
ultimate
not only
mic drop.
did it, but I did it with a mic drop.
Yes.
And I was summa cum laude when I graduated. So
Come
thank you
through.
very
Yes.
much.
I
You know,
love it.
we all want those feelings and we all want, you know, our lives to matter. And it's people like you guys in your care and the fact that you don't stop and that you don't give up. Um, that means the world, not just to myself, but every single warrior I'm blessed with meeting and contacting. And I just want to say thank you, not
Yes.
just from myself, but for everything that you all do, for all of the other Lydias out there in the world that are suffering, that are struggling, that are thinking they can't do it with a dab or a mic drop, and you're there to let them know, like, yes, you can. You can do this. And you're going to go
Wow.
and you're going to go to college, whatever one you want, and you're going to get a scholarship, and you won't pay a thing. They'll end up paying you to go to college. And you know, without that encouragement and support that you all give, none of this is possible.
Wow.
Not even life, because I wouldn't be here without the 600 plus donors that have given life to me. So thank you all so much. And I feel like the biggest takeaway is to go donate.
Yes.
Go
Absolutely.
donate blood. Go and be somebody's hero, because y'all are my heroes. And there's a lot of people that need a hero nowadays, especially. So you can do that. You've got that power and that
Yes.
gift to go and do that for somebody else. So do it. I can't do it myself, but I'm sure I'd feel so awesome about myself and be like, yeah, I just helped her succeed and she's
Yeah.
going to go and live a great life.
Right.
And you all should be able to do that, and you all do that. So thank you
We are
very,
so
very much.
so grateful for you. And you have no idea. You've become a shero to so many people just because of your story and sharing your story and being open and vulnerable, and just being exactly who you are, Lydia. And we're so grateful for you. You got me over here
Thank
teary-eyed.
you. Thank
Yes,
you.
you're welcome. We're
I
gonna
told
take
my sister, I said, I hope I don't cry.
it's
That's my
okay.
biggest thing, is I don't want to like just cry. But you
Right.
guys
But
are warriors and sheroes and heroes, and I couldn't live without you. And that's the truth. So thank you.
that's the beauty of who you are. You're able to be exactly who you're supposed to be in this moment and living like you're supposed to live. You are truly an angel here, and we're gonna do whatever we can to make sure you see the next beautiful days and months and years of your life. So
Yes.
let's do that by donating blood.
Thank you.
That's right.
Yes, absolutely.
redcrossblood.org/our blood. We do have some great questions from the audience. We have a question from Imani Pittman. Is there a way to donate blood to a specific person? How does that work, Dr. Miller?
Well, in general, when a person donates blood, you cannot specifically, donate blood for an individual. There are some very specific circumstances when that can occur, but that's unusual. So when a person donates blood, that blood goes to whoever needs it at the time, and that's why we need, a diverse pool of donors. That's why we need African Americans to donate, because when blood is needed, only blood will do. And that blood needs to be available for everybody that needs to have that blood transfusion.
Okay, got you. That makes sense. That makes sense. Because I know a lot of people, when they get attached to someone, they're like, I want my blood to go to Lydia, and that's it. But there are so many people who are in need of blood as well, including our lovely Lydia. All right. So we have another question from Jody Shetty. How can donors prevent a deferral for low hemoglobin?
So, yep, that's my question.
Yes, that's your question.
So as African Americans, we normally have, it's normal for us, but it's on the lower end of the range of iron, of hemoglobin. So we definitely need to make sure that we talk to our healthcare providers and make sure that we get our iron tested by our healthcare providers so they can know where we are, and then make the recommendations for iron supplementations. Most people in this country already take a multivitamin with iron. And in many cases, that's exactly what your healthcare provider will say, is they take that multivitamin with iron every single day. So, and there are a lot of people now that are on plant-based diets. And we get a lot of our iron from meat. So if you're on a plant-based diet, definitely make sure you check in with your healthcare provider, who may even recommend that you see a nutritionist to make sure that you have a diet that's high enough in iron to keep your iron levels up. So thank you so much for that question.
Absolutely. Well, here's another one for you. Can groups donate together? So can, groups say, you know what, let's go and do a community service venture and donate blood together?
Absolutely. We absolutely encourage that, as a matter of fact, to have, organizations host blood drives. Again, during COVID, there has been some difficulty finding, community centers and different places in the community to host blood drives. But if there are organizations or groups that want to host a blood drive, you can definitely identify a location, partner with your local Red Cross, call them, say that we want to host a blood drive, and we will do everything that we can to partner with you and get that set up. We absolutely encourage groups of people to donate.
Yeah, absolutely. We're encouraging the entire Divine Nine. I'm a part of that. I'm going to bring that to my chapter, the Pi Alpha Mega chapter of Alpha Kappa Alpha, and we're encouraging everybody else. Let's come together and donate blood. We got to get these numbers up 2 to 3%. That's not good at all. And to see how our blood can help Lydia have a great day, like, what's better than that, to give life to someone else? I don't think there's anything greater than that. But I'm glad that we had this conversation, because people get a better understanding of how it actually works. I think people sometimes don't understand how things work and how it benefits sickle cell patients. And now we had a better understanding of that tonight. So we're grateful for that. Last words, Christy, what would you like to share as we, wrap up?
Well, one, I feel like I've received a gift tonight, just to hear from Lydia, and to hear just all of the good advice and facts and everything from Dr. Miller. And so I just want to say that the NAACP, we're honored to be a part of this work, and could think of no better partner than the Red Cross, just in service to our community. And so I want to thank you all. I want to thank you all for being willing to be in this work and committed to it. And I agree with Sean, we've got to do better than 2 to 3%. Yeah. So I'm a Delta, even though we're across the, the aisle here, but the Divine Nine definitely has to get involved. And I think we do everything we can to encourage folks to be a hero, be a shiro, just like you said, Lydia, because there is something we can do. And so take action, donate blood.
Yeah. That's right. So Christy, we're going to get together on that. Maybe we can spearhead that together and then bring on the Zetas and the SG
Mhm.
Rose and all of our brothers, and do it, because you just never know how, when we come together like that, what we can do in these massive numbers. So I'm so glad we're having this conversation tonight. I am so driven. I am so ready. I am ready, ready, ready. Dr. Miller, what are your last words? What would you like to share with our
So,
audience?
thank you. So again, I am just grateful for Lydia and for Christy and our relationship with the NAACP. And, I am a member of Delta Sigma Theta Sorority Incorporated as well. And so I'm always on my chapter about hosting blood drives. And so the call to action is right now in this moment, when we finish this call, go to the redcrossblood.org website and make an appointment and keep that appointment.
Nice. That's beautiful. It's funny. I have to do a little plug before we get to Lydia. My mother-in-law is Beverly Smith, your national president. I'm married to her son. Isn't that funny? I know. I had to say it. I had to do the
That's
plug. I
amazing.
know. I know. We've
Amazing.
got the whole D9 in our
Amazing.
family.
Yes.
Yes. So Lydia, we could not I wanted to end with you, because you are the reason why we are here. And I am so enamored of you and your spirit.
Thank you.
I mean, 2 days ago when we spoke on our prep call, I was just immediately drawn to you. And I know that our audience feels the same exact way. Can you give us your parting words, Lydia? And whatever comes, let it come.
I'm so grateful. Grateful, blessed, thankful, all of those words. And to say that it's been easy, it has not been. No, it is not at all. Sometimes it is the most difficult thing to do in the world, is to smile when you're in pain, and to just live and exist in pain. But to know that there are people out there that care. There are people out there that see that you're going through something and they want to help you. They want to help you get past it. They want to help get that blood that you need so that you can keep living and you can live your dreams, and you can do your mic drop and on life and live your best life. There are people that care. I am one of those people. If I can do something and I can say something about my life and it helps another person with sickle cell and they don't have to go through those struggles because I spoke up about it and I said something, then it's something that I'm going to keep doing. And I'll always be here to speak out for warriors. If you are a warrior yourself of any kind, um, and you want family, you want support, please know that you have it here. You have a genuine family. The NAACP, the American Red Cross, me as just my own personal self, and you've got a family that cares about you and loves you deeply and wants to help you. And so don't give up. Just don't give up. And always know that there are brighter things coming. Um, as Dr. Miller spoke about the cure and stem cell, everything that's going on scientifically right now, better days are out there, warriors.
Yes.
So just keep on believing and keep on receiving and keep on being thankful. And I'm so thankful to all of you who have donated in the past, who will donate, who will keep on donating. Thank you, because
Yes.
you're allowing me to have another day in this world. And I I cannot say thank you enough to that. So thank you all very, very much for taking the time.
Yes. Thank you, Lydia. We appreciate you. You are a superstar, and we're so
Thank
grateful.
you.
And
Thank you.
for all our believers out there, make sure we add Lydia to our prayer list and send her good energy, and all of the warriors out there. And we are imploring the community again, please, please,
Yes.
please, redcrossblood.org/our blood. We talked about the diversity of our blood. Dr. Miller spoke about that at length. We're very special people. So we have very special blood. And our very special blood can do very special things for very special people. How about that? Christy,
Yes.
thank you so much for representing the NAACP. We appreciate you. Again,
Thank
Lydia,
you.
we are so grateful, so grateful. And again,
Thank you.
please give the gift of life.
Yes.
Give the gift of life. Again, you see
Yes.
the website. That is www.redcrossblood.org/our blood. Thank you so much to our partner, blackdoctor.org. We appreciate you. We appreciate everybody who joined us tonight, and we thank you. We are absolutely grateful for you as well. Ladies and gentlemen, be well, be grateful, lift up our sister in prayer, and give blood.
Yes.
Give blood. I am your host, Rashawn Ali. It's been
Yes.
my pleasure to serve you tonight. And I hope that you have, you leave greater than in which you came. So we appreciate you. Be
Yes.
well and be blessed. Have a good night,
Yes.
everyone.
Thank you.
Have a good night, ladies. Thank
Good
you so
night.
much.
Bless you
Bye.
all.